Okay, it is a couple of minutes after noon, and so let's just go ahead and get started. We do have a lot to get through in the next hour, and so let's just jump right in. Good afternoon. My name is Laurie Kramer, and I'm the Executive Director of the Autism Society of Greater Akron. Welcome to the Autism Summit for 2021. Thank you for joining us today. We do appreciate your time. If you are not familiar with the Autism Society of Greater Akron, and we notice there are quite a few people actually from outside of our service territory, so we're going to take just a second to tell you who we are. We are an affiliate of the largest and oldest grassroots organization in the country, the Autism Society of America. We were founded in 1987, and while we're not a direct service provider, we are a hub of information and resources in our community on autism and developmental disabilities. We basically serve in that capacity with a number of professional partners, as well as serving individuals and families who live with autism and other developmental disabilities. I want to thank our sponsor today, Cleveland Clinic Akron General and Cleveland Clinic Children's. Our partnership has led to a number of initiatives that not only supports the mission of our organization, but also has improved our community for people living with a disability. The Autism Society of Greater Akron's first Autism Summit was held in 2015. And while it has taken on a number of different looks over the years, the one thing that is in common is that we have always focused on issues that are important to individuals and families living with autism and other developmental disabilities in our community. And we take on issues that are important not only right now, but that really need to be raised to our leaders in our community and our elected officials. And so we're going to talk about that a little bit later. This year's topic is no different as we talk about the COVID-19 crisis, and specifically on the COVID vaccine as it relates to the disability community. As part of the Autism Summit, we surveyed people in our network about their questions, concerns, or support for the vaccine. Almost 600 parents, self-advocates, and direct support professionals answered the survey, including 44 pages of questions and thoughtful comments. Thank you to all of you who took the time to take that survey. It really did provide us a great deal of information. We heard you, and at the end of this webinar and Facebook Live, we will outline the policy recommendations that our board adopted as a result of those questions and comments that you provided. In addition, those comments and questions are what we asked our panelists and our speakers to address today. But before we get started, just a few housekeeping items. This webinar is being recorded and we are on Facebook Live. And you will be able to find the recording, the survey results, and policy recommendations on our website at autismakron.org/2021-summit. There are also links to COVID resources that address many of those questions that you asked us in that survey. Unfortunately, we're not going to have time today to be able to answer all the questions, but please feel free to put your questions in the chat box. Our speakers have graciously agreed to work with us to answer those questions, and we'll send those out later on as soon as those answers are available. At the end of the presentation, you're going to receive an evaluation, and we would really appreciate your just taking a moment to let us know how your experience was with us today. Finally, I want to thank the Autism Society of Greater Akron's Advocacy Committee, who put a lot of hard work into this year's Autism Summit, especially Dr. Jessica Foster from Akron Children's Hospital, who helped us navigate this difficult subject. We really did need someone like Dr. Foster and Dr. Lanzinger, who you'll also hear from, to sort of help us figure out how to navigate this subject and what we can do to support individuals and families better. I now have the privilege of introducing Dr. Lisa Wiggins from the U.S. Centers for Disease Control. She is currently deployed as the Disabilities Unit Lead within the CDC Vaccine Task Force. In that role, Dr. Wiggins works with advocates, partners, and jurisdictions to ensure equal COVID-19 vaccination access for people with disabilities. Dr. Wiggins, thank you so much for being here today, and I'm going to turn it over to you now.
Great, thank you very much. I am going to share my screen so that you can see the slides that I am presenting today. Are they visible? Great, thank you. So again, thanks to the Autism Society of Greater Akron for having me here today to speak to you. It is a pleasure. CDC is committed to ensuring equal vaccination access among members of priority populations and also addressing any of your concerns that you have about the COVID-19 vaccine. So these town halls and webinars are very important for us to not only hear your concerns, but to let you know about all of the wonderful work that we're doing at CDC. So I'm just going to take a brief moment to introduce you to some of the work that we've been doing with the disabilities subunit team of the Vaccine Task Force. And we are part of a larger team that's called the Disproportionately Affected Adult Populations Team. And the goal of the DAP team is to ensure equitable COVID-19 vaccination among disproportionately affected adult populations. And people with disabilities have been identified as one of those adult populations. Some of the other populations that we serve in the DAP team are people in long-term care facilities, those in detention centers or prisons, people with high-risk medical conditions, those experiencing homelessness, people in rural or remote areas, racial and ethnic minorities, and older adults. So we take a very broad view of disability, and we adopt the ADA definition that disability is a condition that significantly limits one or more major life activities. So this can include conditions that affect hearing, learning, moving, seeing, and socializing with others. And it is estimated that about 1 in 4 people in the United States is living with a disability. Autism is considered a condition that can limit major life activities, so it is included under the disability category. Some people with autism may be at higher risk of getting COVID-19 due to where they live, such as a community-based group home, the need to have close contact with family members or other caregivers, or trouble adhering to medication strategies like wearing a mask or staying 6 feet away from other people or washing their hands. Some people with autism may also be at increased risk for having severe illness due to COVID-19 due to their underlying medical conditions. And some of those conditions are diabetes and heart disease and obesity. So the disability sub-team of the Vaccine Task Force has developed 5 different goals that will help us ensure equitable vaccination access for people with autism and other disabilities. And I'm going to go through each one of those goals and tell you a little bit about our activities that align with these goals. So our first goal is to disseminate materials in a variety of accessible formats. We already have information on the CDC website in easy to read formats, resources for people with limited English proficiency, and resources for that are in American Sign Language. We have also partnered with the Georgia Tech Center for Inclusive Design to continue to translate our COVID-19 vaccine materials into accessible formats. Our second goal is to raise awareness about the COVID-19 vaccine, especially how the vaccine relates to people with disabilities and their unique needs. So we have created a variety of different web content and other resources. We have web content on what people with disabilities and their caregivers need to know about the COVID-19 vaccine. And we also have guidance for vaccinating older adults and people with disabilities for both jurisdictions and vaccination sites and providers. And you can find this information in our disability toolkit, and the link is provided here. We also participate in a variety of webinars and town halls, such as this one. We have participated in other webinars and town halls with Autism Society, Autism Speaks, the Administration for Community Living, and then the Consortium of Citizens with Disabilities. Another one of our goals is to address vaccine hesitancy within the disability community. We are adopting CDC's Vaccinate with Confidence framework to accomplish this goal. And there are 3 pillars within that framework: building trust, empowering providers, and then engaging people and communities. Our fourth goal is to remove barriers to equal COVID-19 vaccination access. So we have been meeting with partners and jurisdictions to get a better understanding of the vaccination landscape. We are particularly interested in hearing about challenges that jurisdictions are having vaccinating people with disabilities and promising practices and innovative strategies that we can share with others. We also promote existing CDC resources, such as the jurisdictional playbook and its annex. The annex was released about 2 weeks ago and has guidance for jurisdictions on reaching and increasing vaccine uptake in priority populations. And then we also collaborate with other vaccine task force units to remove barriers to vaccination access. For instance, we have been collaborating quite a bit with the older adults unit on how to vaccinate people who are homebound or isolated. And then our fifth goal is to include people with disabilities in emergency response efforts. So we understand that it is extremely important to include people with disabilities in emergency planning efforts from the very beginning. We have offered funding to different sites to make sure that people with disabilities are at the table in emergency planning efforts at the state, the city, and the county level. So that ends my presentation. I'm looking forward to hearing your questions and engaging with you in conversation later on. Thank you.
Excellent. Thanks so much, Dr. Wiggins. We really appreciate that. I think you shared a lot of great information, and it's a great way to get us started in our discussion today. I'm Jessica Foster. I'm a developmental pediatrician at Akron Children's, and I'm a board member of the Autism Society. So as a board member, I'm here to moderate the discussion today. I just wanted to quickly give one more thank you to all of the folks who responded to our survey. It really was absolutely incredible to see all of the thoughtful comments and questions that folks had. This is clearly a subject that people are passionate about. And so what we're hoping today is that through this discussion, we can bring a voice to the folks who responded to our survey and get some answers to some of those wonderful, thoughtful questions. So I'm going to just quickly introduce our speakers. And actually, you all have bios attached in the information that was shared with you through the link for the Zoom today. So I'm not going to read everybody's bios because we want to have plenty of time to talk through questions. So first, Dr. Scott Pangonis, if you want to wave your hand, Dr. Pangonis, is an Associate Director of Infection Control and Pediatric Infectious Disease Physician here at Akron Children's with me. Dr. Donald Dumford, if you want to wave your hand for folks, is an infectious disease specialist at Cleveland Clinic Akron General. Superintendent John Trunk, and he is with our Summit County Board of Developmental Disabilities, and Health Commissioner Tom Quaid with Geauga County Public Health. So we're hoping that these voices will, again, help to answer some of these wonderful questions and bring light to this important subject. So I would love to actually open it up with a couple of questions to Dr. Wiggins to kind of follow up on your talk. It was great to hear about all the effort being made around vaccine rollout, especially to this really critical population. We know that folks, many folks are anxious to be vaccinated, and we know there have been challenges with getting access to vaccine. And I wonder if you have any comments about what's being done to increase availability of those doses that are in the pipeline.
Yeah, that's a great question. And it's one that we're hearing quite a bit from partners and other stakeholders. So as you may have heard in media outlets, Johnson & Johnson has asked for emergency use authorization of its single shot COVID-19 vaccine. And if it is authorized, the manufacturer could supply up to 20 million doses by the end of March. Pfizer and Moderna are also working to increase their vaccine supply. CDC also developed the retail pharmacy program to increase the population's access to the COVID-19 vaccine. So we know that most people within the United States live within 5 miles of a retail pharmacy, and that they are uniquely positioned to support broad COVID-19 vaccination efforts. So this program involves 21 national pharmacy partners and independent pharmacy networks that represent over 40,000 retail and long-term care pharmacy locations nationwide. So these pharmacies that are enrolled in the program will receive direct allocations of the COVID-19 vaccine from the federal government. It's not going to affect weekly jurisdictional allocations, but jurisdictions can transfer their allocations to the retail pharmacies given need.
That's great, thanks. And another question that I had for you, Dr. Wiggins, just to follow up again on your talk. A lot of our respondents, in addition to being anxious about getting access to the vaccine, are really anxious about the vaccine itself. And we had several folks talk about a fear of sort of feeling like a guinea pig, especially with the quick rollout of this vaccine. And I'm wondering if you could help us understand a little bit more about how the vaccine trials have worked. And specifically for this population, has the developmental disability population been a part of those trials? And were people with autism specifically included?
So the COVID-19 vaccines, they are held to the same safety standards as any other routine vaccines. Several independent and expert groups evaluate the safety and the effectiveness of the vaccines before they give them to people in the United States. The FDA in particular reviews all the safety data from clinical trials before vaccines receive authorization or approval. Also, the Advisory Committee on Immunization Practices, which consists of a variety of different medical professionals and members of the general public, review those safety data. So research shows that both the Pfizer and the Moderna vaccines are safe. We know that for at least for individuals 16 years of age and older, and Moderna is currently testing it on individuals 12 years and older. People with individuals with disabilities, including autism, were eligible for clinical trials. We do not know how many participated in clinical trials because the data on the COVID-19 vaccines were summarized for all people in the study. So results show that they are safe. Some people did have side effects. The most common side effects were pain at the injection site, sore muscles, some of the more common side effects that you would see with routine vaccination. And only about 1 in 100,000 people had a serious allergic reaction.
Great. So I know, we just heard a little bit about what is happening in terms of trying to ramp up the supply and access sort of from your perspective. To follow up on that topic, I'd love to hear from Commissioner Quaid a little bit more about vaccine distribution in Ohio. And how that's been rolling out and how we're trying in Ohio to make sure that the vaccine reaches the groups that it needs to reach.
Right. So let me preface it by saying that each health department or each county in Ohio is operating on the same plan, but they may have nuanced differences. So when I'm talking about what we're doing in Geauga, it's probably very similar to what's going on in Summit County, but it may not be identical. So as folks hear something, have that understanding. In general, the state's plan has been one where they've started off with priority groups. They said that these folks in this group are eligible day one, folks in this group are eligible, a week later, folks in this group are eligible on this date and so forth, to guide the administration of the distribution of vaccine to the public. That first population, that phase 1A, and they could have come up with a less imaginative name for this, but the phase 1A group were the folks that were providing care. There were EMS providers and so forth. There were also people who lived in congregate settings, which is one that's very familiar to the folks on this panel. Certainly not everybody with a disability is in a congregate setting, but disproportionately folks in congregate settings are folks that experience one type of disability or another. Part of the reason that they were prioritized was not only their individual circumstance, but their environmental circumstance. Because of the way that the virus is transmitted, both your individual behavior, but also your environmental immediate surroundings, both lead into that, as well then is considered the your relative negative outcome, of an infection or disease state that might be exacerbated for any number of reasons. But the state has really considered the risk of exposure, the risk of infection, and the risk of most severe negative outcome. That's how they prioritize these lists. One of the challenges has been that list was sort of predetermined and has grown exponentially larger and more quickly than the availability of the vaccine. And so as that population of eligible, or the eligible population expands, logistically, it becomes almost impossible to then say, well, you were eligible before you, so now you're going to get yours before you, right? It's either sort of an dichotomous eligible, not yet eligible. And so once we get a very large eligible population, the prioritization sort of falls apart a bit.
So that is a great lead-in to a question that was reflected throughout the survey from our caregivers. So we had a lot of caregivers and parents who really expressed concern about, gosh, if I become ill, who is going to care for my child with autism or developmental disability? And a lot of folks have had concern about the decision of why caregivers with individuals with intellectual disability or developmental disability shouldn't also be prioritized as a group to receive this vaccine. So I think part of your comments have addressed this, but I'd love to hear your thoughts on potential challenges or implications for prioritizing that group. And I think this is a really important question, so I'd invite others to weigh in too. I know Dr. Wiggins has been a part of these conversations as well at the level of the CDC.
Yeah. So first, let me say I'm probably right there with them in that response. I, in full disclosure, have a sister for whom I'm a legal guardian who lives with severe developmental disabilities and is also served by the Summit County Board of Developmental Disabilities. And it was a question of mine, years before COVID, right? Who does that work if I'm not able to? And now in the time of COVID, when my sister is in a house with a housemate similarly disposed with staff who take care of them, my concern is, well, what happens if that staff then becomes incapacitated in some way? It's a question that John's heard me raise at a board meeting several times. What are we doing to make sure that we've got depth with the care providing staff? There are some challenges. Obviously, one could make an argument for most populations about why they could be or should be prioritized. It does not take away from an argument that somebody else might make about their own set of circumstances. What we're dealing with is a very challenging environment in which the general public is not used to experiencing not being able to get what they want, when they want, how they want. We live in a world of extreme disparities for any number of reasons. Most of my work has been sort of trying to overcome and get rid of disparities with regard to health outcomes, healthcare access, health access, not just healthcare access. And obviously the population living with developmental disabilities or any other disabilities are on the sort of the losing end of most of those disparities. I agree. I think that the folks that are responsible for providing care for those populations should be prioritized. It's a matter of degrees, and at what point do you hit a threshold where there's enough vaccine to even have that language matter, right? If there aren't enough local doses, expanding a prioritization group does not put that vaccine in that person's arm. So those are some of the pragmatic challenges.
And I would like to add, just for educational purposes, the Advisory Committee for Immunization Practices makes recommendations to CDC based on scientific data, preferably at the population level. And then CDC adopts those recommendations based on scientific data. At that point, jurisdictions can adopt or modify those recommendations based on the needs of their community. So you do see some jurisdictions who have prioritized people with disabilities and their caregivers in higher phases than other jurisdictions. There's a great deal of variability in state plans. Direct service providers, home health care providers, and hospice workers are considered essential workers and can be prioritized in any of those phase 1 subcategories. And then we also, in having conversations with our partners and with jurisdictions and other stakeholders, we do recognize that vaccinating family members and other care providers is a great concern. So we do have a web content coming out, hopefully by the end of this week, that encourages jurisdictions to consider vaccinating care providers and family members at the same time that people with disabilities are vaccinated, giving their state plan and given vaccine supply. So of course, supply versus demand, like Dr. Quaid said, is a serious issue. We want to make sure that the most vulnerable people are vaccinated first, but we do recognize that this is a concern.
Yeah, and it's exacerbated with the challenges of actually accessing a scheduling process, or getting one into a clinic. So it's not just about being eligible; it's having access once you are eligible. And different folks interface with that system differently. And in terms of how passive or how active we need to be to make sure that when folks are eligible, they're actually having access. And so those are additional challenges.
Dr. Foster, I might follow up on that just
please.
briefly with a couple of comments from the county board's perspective. Our role in this rollout has really been to help coordinate the access to vaccinations as they become available. And in our case here in Summit County, either through the public health department or through the rollout of the 1B vaccine through Akron Children's Hospital. And we've lobbied as a county board and as an association for more vaccines to become available to caregivers. And of course, caregivers were available through the 1A rollout, although not always family members. And the number of people that chose that vaccine was less than we would have liked, but that's perhaps a topic of another question you might have. But I must say that all things considered, I feel from my perspective, our governor has done a pretty good job of lobbying on behalf of persons with disabilities and their families. We support about 2,600 individuals that we've estimated would fall into that 1A and 1B category. Adults either in a congregate setting or living alone, but needing support. And we've been successful now coordinating vaccine clinics with the health department and with Akron Children's that have gotten vaccines to about 1,600 individuals, still short of our goal. But we've looked for other ways to support those families and to support those providers through the availability of PPE and things like that to kind of fill that gap until more vaccines are available.
That's great. Thank you very much for that. And actually, I'm going to hand it right back to you as sort of a follow-up. So the flip side of this issue is that we do have concerns with vaccine hesitancy in this population, but also in the providers that are serving this population. And we had several folks ask us specifically about our direct support professionals. And we did have direct support professionals who responded to the survey that they would definitely get the vaccine. We also had about 30% that weren't sure or said no, and they were worried about things like safety or long-term effects. but again, we know our population of individuals with developmental disability really rely on these folks. So the question is what do you see as the best way to begin addressing vaccine hesitancy in this workforce?
Well, that's a great question, and maybe the million-dollar question. We decided here to kind of approach the problem and the challenge head on. In Summit County, we're blessed in some ways that we work with a number of providers, a broad network of providers that are actually in people's homes, and they employ the staff that do a lot of the direct care work. So in our case, we have to kind of work through the leadership of those providers to address this issue. And what we established, what our board really required of me and our administration from day one was to get information out, to be accessible, to provide data, to pass on the toolkits, as Dr. Wiggins described it, were available through our local sources and CDC, so that people were educated. What we found through the first couple of clinics that we coordinated was that absolutely there was hesitancy on the part of a lot of direct service professionals the first time through, but as they saw coworkers not having serious symptoms or doing okay and moving along without any real complications, the second and now the third time around, we've seen more and more direct service professionals come back and take advantage of it. We've also done some outreach. We've created some of our own public service announcements geared at some of the hesitancy directly experienced by direct service professionals. And even kind of a variation of that is within the African American community. We've done more outreach and tried to create more awareness to break down some of those very legitimate concerns that they have. So a lot of information. I think experience has helped those percentages of DSPs take advantage of the vaccine. And then again, we've just, in the meantime, supported those providers with as much PPE, cleaning supplies, and other things as we possibly can.
That's great. So I definitely want to get over to Dr. Dumford and Pangonis to talk about the disease itself and a little more about the vaccine. But before we do that, because you just mentioned the Black community, you know, we have definitely heard a lot about disparities in access within that population. And sure enough, our survey response said the very same. So in our survey, 55% of our Black survey respondents said yes or probably yes to receiving the vaccine, 45% saying unsure or no, compared to 75% of our white survey respondents saying yes or probably yes, and 25% saying unsure or no. And of course, as you just alluded to, you know, our individuals with developmental disabilities, you know, potentially face a real double disparity here. So Commissioner Quaid, I don't know if you have anything to add to what John Trunk was just sharing with us about this particular population.
Sure. Well, it's actually probably something that spans both the population living with disabilities as well as the people of color. We have an issue of oftentimes jumping in with a solution and with the language and with the idea and with the explanation because we fancy ourselves to be the experts in most of these things, rather than stepping back and saying, if we're talking about folks who have issues of trust of a system, trust of an individual that's borne out through historical experiences, probably the first thing we need to do is shut this and use these, right? So it's a matter of stepping back and saying and asking questions and learning, what are those reasons for that hesitancy, trying to understand that, and then not to take the next sort of knee-jerk step and answer from our own place. It's answer from the place where they are. So involving folks in that conversation, you work with the folks who don't have that hesitancy but are of the population and learn why it is that they don't have that hesitancy, and then incorporate them as champions or ambassadors for whatever it is you're trying to do. I think this is a strategy that's borne out. It's a different strategy. It takes a little bit longer than we're accustomed to. It doesn't fit some of our normal standards, but no, when we're saying that our normal standards produce a disparity, perhaps that's a good thing. Yeah.
That's great. Thank you for addressing that. So I want to shift gears a little bit. Like I said, there were lots of questions about the vaccine itself and also the disease in the population of individuals with developmental disabilities. And so folks who told us that they would get the vaccine, or folks who intend to vaccinate their child, said that they wanted to do this because they believe the vaccine is safe. And they also talked about being worried about getting the virus themselves and worried that their family members might get the virus. Dr. Dunford, I'm wondering if you can comment a little bit on COVID-19 disease in individuals with developmental disabilities. And I know Dr. Wiggins addressed this a little bit in her talk as well, but is there an increased risk for more severe disease? And if there is, again, how effective is that vaccine at preventing this virus or reducing the effects from that severe disease?
Right, and thanks. First off, thanks for having me. Really appreciate having the chance to be part of this. So we do know that patients with developmental disabilities do have a higher risk of severe disease related to COVID. And actually, there's about a three times the rate of mortality in this population. Actually, one particular study I was looking back at showed that the exact odds ratio is 2.8. So if you look at it, there's a almost three times rate of fatality from this, and it's probably largely related to the increased risk of other comorbidities in this population, diabetes, heart disease. I think that's really driving that increased risk. And then, that's what we see with the developmental disability population. As many have probably heard that are listening to this, if you talk about vaccines and how good they are with protection, I would say that these vaccines that are coming out are fantastic. If you look at a good year for the flu vaccine, you consider a good year for the flu vaccine to be 50 to 60% efficacy, meaning that you're reducing the chance of symptomatic illness by half. The Moderna and the Pfizer vaccine are each about 94, 95% effective at preventing symptomatic disease. So if you look at the studies that were done, for every 20 people that got COVID that were in the placebo group, or the salt, sugar, water group, one person that got the vaccine got COVID. And if you say, okay, well, that's great. Most people that get COVID aren't going to have severe disease. What about those patients with severe disease? Then you look and you say that it's fantastic, what it did for those with severe disease. If you look at the Pfizer study, they went, comparing placebo to the vaccine group. There were 9 severe cases of COVID in the placebo group. There was 1 severe case in the study group. So that's what, about 92% reduction. And then if you look at Moderna, you went from 11 people in the placebo group to none in the trial group having severe disease. So there's a fantastic reduction in the risk of severe disease and thus death too. If you look at what's coming down the pike next and look at the Johnson & Johnson, which a lot of people are liking the fact it's 1 dose instead of 2. The efficacy for that goes down, at least in the US population, to 72% for preventing symptomatic disease. However, it did a fantastic job of preventing severe disease. I can't remember right off the top of my head what the placebo group was, but out of the trial group, only 1 person had severe COVID with it. I think they said it was like a 90% reduction. So really the efficacy of this vaccine compared to the normal vaccines is off the charts. And as Dr. Wiggins had said, it's a very, very safe vaccine platform, either when you're looking at the mRNA platform for Moderna and Pfizer, or the adenovirus platform for the Johnson and Johnson. Do you want me to start talking about side effects, or I feel like
Yeah. So that actually is the flip side to this
Yeah.
question, is that folks are also worried again about the safety of the vaccine itself in
Yeah.
individuals with autism and developmental disabilities. And should people be worried about long-term effects from the vaccine itself? And how would you kind of answer that question or address that concern?
Yeah. I guess first I'll share my personal experience with the vaccine, both mine and my wife's, because we've both gotten both doses of the Moderna. So first dose, I did fine. I had a very mild soreness of my right arm. The second dose was kind of bad. I got my dose at 8:30 in the morning, 3 o'clock in the afternoon. I said, I feel a little bit punky. I had some chills overnight. The next morning, I woke up. I felt feverish, felt chilled. I was having body aches, had a little bit of a headache. By 3 p.m. That day, so 24 hours well, I guess it was about 30 hours after my vaccine, I felt fine. And my wife had pretty similar side effects. If you look at sort of the data from the trials, you see that most of this, I sort of will summarize the second dose, because first dose, unless you've had COVID before, the likelihood of side effects is a lot less. It's sort of thinking about it that first dose is priming the immune system. The second dose is making sure that your immune system is coming online and you have antibodies. So with that second dose, and I'm actually going to pull up my numbers just so I don't mess something up here. Looking at things, it's about 2/3 of people with the Johnson and Johnson would get injection site pain. 85% with Moderna and Pfizer would get injection site pain. There's quite a bit of headache, so 50 to 60%, depending on which of the platforms. Quite a bit of fatigue. So for Pfizer was 63%, Moderna 68%, and Johnson & Johnson was 50%. About the same for those with muscle aches. And then there's some other less common things like fever in about 15%. Sometimes with swollen lymph nodes, sometimes with some later reaction site pain. And I know for our family, my wife had this like sort of 3-inch red spot at the injection site, which happens, I think, like 3% of the time in people. So I weigh all that, and as Dr. Wiggins said, the likelihood of a severe adverse event is about 1 in 100,000. Even with the recent CDC survey, where people were actually sending in through the app about what their side effects were, it was still 5 out of 100,000. You figure those are people that are, people that are responding are more prone to be, have problems than in like the state groups. The state group is 1 in 100,000. So I weigh that against the effects of COVID. So with COVID, you're looking at most people are going to have not severe illness. 5% of people that are going to end up in the hospital. As with the raw numbers right now, we're looking at a 2% mortality rate among people with COVID, which, if you think about it, is astounding. If you compare it to flu in any given year, that's about 0.17% to 0.5%. We're looking at something that's much more lethal than the flu, even if most people are going to get better with no problem. And then, I even think, most of this is in the older population, but I even think about a couple patients I had. I remember 2 guys I had at our long-term care facility we go to. Both were around 45 years old, no health problems, and they both ended up on a chronic respirator and on dialysis in their recovery. And we're in that setting for a few months. But that's not the usual, but still that's what could happen. And then you also think that people that recover, they're finding that there's a lot of long-term sequelae from COVID. At 2 months, there's a lot of people that are still having shortness of breath, still having chest pain, still having cough. There's even a lot of studies that show that as far as 6 months out, people are still having difficulty with concentration and brain fog and those sort of things. And I couldn't find anything specific that showed with the developmental disability population if there's any increased risk of those effects. But I kind of think if you're, that I worry about things like those long-term neurologic sequelae in this population. So when I think about whether to recommend the vaccine, those are the sort of things I think about when weighing those decisions.
That's great. Thank you very, very much.
Oh.
So I would love to shift this very same topic to the pediatric population. So Dr. Pangonis, just quickly to add, parents also are very afraid of vaccinating their children, and because they may fear sort of long-term effects of the vaccine for their children. How would you respond to that?
So I know that because this is a new vaccine and it's a platform that hasn't been used previously, this has raised the amount of concerns that people have had prior to this. Although in regards to long-term effects, so usually when with any vaccine, most or if not all adverse events are going to occur within 6 weeks. Most of them are going to occur immediately or shortly after you get the vaccination, but some can be delayed, and the more serious events can be delayed by sometimes days up to weeks. Because of this 6 week window, the FDA has been requiring at least 8 weeks of follow-up data or safety data after the last vaccine. So,
Okay.
and as far as children or adults with developmental disabilities, I'm not sure if they would be at, or at least I can't think of a reason that they would be at any more increased risk than the general population. And usually the reason why we target these kind of populations are, as some of the other people have said, is that may be at higher risk for mortality or for hospitalization because of their other comorbidities.
Okay, great. One other question I wanted to ask you, and or even, I'm not sure if you or Dr. Wiggins are the better one to ask, but we know that right now the vaccine is not approved under age 16. And I know Dr. Wiggins mentioned a little bit about the trials down to age 12 with Johnson & Johnson, and specifically our respondents are wondering about the Johnson & Johnson vaccine. And I'm wondering if you can tell us a little bit more about the development process for the vaccine in children, and then again, if children with disabilities are being included in that process.
Okay. Yeah, so as far as the Johnson & Johnson, I believe that the meeting for the emergency use authorization, I think is going to be tomorrow, if I remember correctly. So after they start rolling out that vaccine, they should start, they're already in the process of planning for kids younger than that. I think usually they're going to do, most of the groups are going to do what we call an age de-escalation. So they're going to start with the older kids and then move down younger and move down a little bit younger. I don't think there's any studies below age 5, but just to kind of summarize what each group is doing. So Pfizer has already completed their enrollment for ages 12 to 15. I think they have about 3,000 children in total. Following this study, they're going to start trials in age 5 through 11, depending on what the data shows in that older age group. Moderna is enrolling for ages 12 through 17. I think that they've had a little bit of a slow start trying to get people enrolled, but as long as they're able to get enough patients and then their data looks favorable, then they'll move down to the 5 to 11.
Okay, great.
And then I think the AstraZeneca was the last one, but I think their studies in adults were paused in the U.S., but they are going on overseas. But I don't know of plans to finish those studies in the U.S. in adults or to go down in kids in the U.S.
Excellent. So I have 2 more big topics that were really important to our survey respondents, and I'm recognizing that we're getting toward the end of our hour quickly, which was what I was afraid would happen with this great subject. So I wanted to quickly ask about schools. And Commissioner Quaid, you're welcome to jump in here too, because I know our public health departments have been working tirelessly with our local school systems around this issue. So Dr. Pangonis, I think you're aware, a lot of our parents and caregivers of kids with autism and developmental disabilities feel like they're in a really difficult position. Their children are missing out on therapies. They're missing out on in-person education. It's messing with, critical schedules and routines that really are causing kids distress and trouble. And yet families are trying to balance the risk of being back in school with these risks of being out of school. And I'm wondering how you would respond to that.
So as you know, I'm not only a pediatrician, but I'm the father of a child with autism. My wife is a full-time stay-at-home mom with our son, so she kind of carries the brunt of the weight when it comes to helping out our son throughout the day. So I think as far as the risks of being in person versus not being in person, so the risks of not being in person, I think, are trying to keep up with these kids' routine schedules. Most of a lot of kids with autism, they're on very rigid schedules. Any change in the schedule can have some pretty significant consequences as far as how well they're able to focus. Even if you can, get them to focus for any period of time. As far as this can also lead to more stress on the parents. If the parents are going to have to, if they have a job or one or more jobs, but their child's not be able to go to school, they're going to have to stay home and figure out how they're going to be able to work and take care of the child at home and be responsible for helping to educate their children. Comparing that to the risk of being in school, the kids may be at higher risk of, or children who are in school with autism and other developmental disabilities may be at higher risk of getting COVID. Know that some children with autism who have sensitivities may not tolerate wearing a mask. They may not adhere to being socially distant from other children. So they may be more likely to get infection and then bring it home to parents. So it's not an easy it's not an easy balance, as I'm sure everyone's aware of. And as far as how to get everybody, or the dates on when schools are reopening, I think that question is maybe beyond me, but I know that in the general population that the data on school reopening is pretty favorable. As far as outbreaks, there's some data that shows that school reopenings may be associated with increasing cases in the community. I don't know that those studies were accounted for other things that were going on in the community that may have better explained that transmission, but it's not no risk. I think that's most of the points.
Yeah, thank you for that response. And Commissioner Quaid, I don't know if you have anything quickly to add, and then I have one more topic for you guys.
When we're dealing with these very tough decisions where there's risk in both directions, right? Then the challenge becomes, well, rather than picking column A or column B, we try to reduce risk in both. And so it truly becomes about risk reduction as opposed to make this decision versus that decision, because there are going to be some folks for whom the nuances will favor one versus the other. So really what we're trying to do is making sure that we're engaging in risk reduction in the schools by getting the school employees vaccinated. The school doesn't have, you can't have a student in a school without the school employees there. We don't have the vaccine for the youth yet. We are seeing spread in schools, but not necessarily tied to the classrooms, where those classrooms are able to have some of those safeties, some of those prevention strategies in place more rigorously, robustly than when we have sporting events. Unfortunately, in Ohio, most of our school conversations tend to be about athletics as opposed to classroom teaching. I think if no school had any sport, we probably wouldn't be talking about going back into school in Ohio. So it's just one of those challenges. Those are the realities that we deal with. So it really, at this point, is just about risk reduction. Wherever we can, we do, but we recognize that there are going to be costs and benefits in both directions.
Great. So I'm going to throw one last question out at Superintendent Trunk, recognizing that this is a question that we teach courses about at universities. So good luck. So another really, really important theme that emerged in our survey is concern by our survey respondents that people with disabilities really may not receive appropriate care from medical staff if they get sick. Folks were worried about how individuals with developmental disabilities might behave or the extra supports that they might need within the healthcare system. And almost 30% of our survey respondents commented that they disagreed that their loved one would be able to receive appropriate care within our healthcare system. And I realize this is not fair that I'm asking you this at the very end, but I wondered if you might help us with some comments on that. And maybe this is one that we can do a little more written response to as well after this panel. Oh, you're muted.
There we go. I'm sorry. I'll
You're
do my
good.
best with a quick response, and I'd be very curious what some of the professors might say in their lectures. Yeah, it's clearly a concern, and we face that challenge as the coordinators and the supporters of families behind the scenes certainly have tried through this pandemic, but individuals with disabilities experience health conditions, are hospitalized all the time. And so we have worked quite a bit with the physicians, with the hospital systems, with the ombudsmans within the hospital environments to make sure that people with disabilities, when they need to be hospitalized or are getting medical care, are getting the best possible care that's available. We have staff that work through the Board of DD that can act as liaisons between the medical community perhaps and advocate on behalf of individuals while they're hospitalized or while they're seeking treatment so that their individual needs and likes and dislikes and worries are addressed. It's a problem that exists, I would say, Dr. Foster, regardless of the specifics of the condition, but certainly a very real one. And I think that's where our staff can play a role in kind of being that intermediary when necessary.
Great. Thank you so much for that, for those comments. So Dr. Lanzinger, I'm going to quickly turn it over to our immediate past chairman of the Autism Society of Greater Akron for a couple of quick closing remarks. And I just quickly want to say thank you so much to our panelists. This was just a great discussion, and we could have gone on for a couple more hours, I'm sure.
Okay. Can you hear me? Am I muted?
You're good.
We hear you. Yep,
Okay,
you're good.
Great. Well, thanks, Jessica. My name is Bill Lanzinger. I'm the immediate past chairman of the Autism Society of Greater Akron, and I'm a hand surgeon at Cleveland Clinic Akron General. And on behalf of our staff, the Autism Society, and our board of directors, I'd like to thank our speakers today. And what a really delightful, 45 minutes we had with you guys. Unfortunately, it couldn't be longer. Maybe next time we can make this a little bit longer. But we appreciate our audience joining us today. And of course, Dr. Foster herself, who with Lori and Lisa Thompson went through our survey meticulously and were able to bring out these questions and led a really fantastic discussion today on these important topics. I'd also like to thank our partners, Cleveland Clinic Akron General and Cleveland Clinic Children's, for their sponsorship. The Autism Society of Ohio, which is actually a collaboration of all the Ohio affiliates of the Autism Society of America, and they helped us with our marketing today. One of the goals of our summit here is to affect change in areas that we identify as important to our individuals and families living with autism. And we learned a lot from our survey, and we want to ensure that the many comments that you all shared with us will go forward to affect changes in our community. We know that COVID's been difficult on everybody, but we also know that those with developmental disabilities are one of the groups that are disproportionately impacted. Therefore, our board of directors will be calling and writing our local, state, and federal legislators to address the following issues. Number one, the issue that we ended with is something that's not new to our families living with autism in our community. We want to address healthcare disparities and better equip medical personnel to care for individuals with intellectual and developmental disabilities when they are ill. People with intellectual and developmental disabilities are 3 times more likely to die from COVID-19. And Dr. Dumford gave us the exact number was 2.8. Our state and national leaders need to continue to address healthcare disparities for this vulnerable population. As you heard, survey respondents weren't confident that their loved ones were going to receive adequate healthcare. And I should mention that the Autism Society of Greater Akron and Cleveland Clinic Akron General collaborated a couple years ago, and Cleveland Clinic Akron General became the first autism-friendly adult hospital in the country. And we hear our communities, we hear their concerns in the healthcare system, and we're doing what we can. Number 2, prioritize caregivers who live in private homes and individuals with severe intellectual and developmental disabilities. We believe the U.S. Centers for Disease Control in the state of Ohio should recognize the need to prioritize vaccinations for caregivers of people with intellectual and developmental disabilities outside of congregate settings. We're talking about parents and guardians here. We feel that you don't have to work in a hospital or group home or nursing home to be a caregiver. You can just be a mom or dad or sister or brother. We also urge prioritizing individuals with severe intellectual and developmental disabilities without underlying medical conditions who would have difficulty managing their illness, and hospital staff would have difficult supporting. Highly involved individuals would also require 24/7 support from their personal caregiver, putting their caregiver at risk and logistically compounding matters. Finally, open schools. We need to provide in-person learning option for individuals who need it. Students with autism spectrum disorder and other developmental disabilities can have a difficult time navigating online learning. And many survey respondents express the need for their children to have access to the vaccine so their children can safely return to school. We urge schools to reopen with or without availability of the vaccine for those who need in-person learning. In closing, I want to tell you the Autism Society of Greater Akron is a nonprofit organization, and we can be the local resource for the information about autism and voice for individuals and families living with autism. We do this because of the support we receive from our community. So thank you again for being here today. Another big thank you to our speakers and Dr. Jessica Foster, who led our discussion today. We're going to continue our progress on these important issues, and I can't end this without asking for a donation. If you feel that you want to help support our cause, you can always go to our website here, and you can follow how we're doing on these important issues. So please go to our website at autismakron.org/donate. And I'll wrap it up there. Thank you again to the audience and speakers. And until next year at the next Autism Summit. Thanks, everybody.